I'm a cranial neurosurgeon, so I have two main focuses. One is on skull-based surgery, and in particular minimally invasive skull-based surgery. And the second is in functional neurosurgery, treatment of movement disorders and epilepsy. I did a fellowship with a group that was one of the leading thinkers in the world of minimally invasive neurosurgery. And the idea is to approach the brain in ways that are less invasive than our traditional approaches. So a lot of the large openings that we used to make or felt were necessary, some of them are not in certain cases, and using either a natural corridor like the nose and the sinuses, or using what we call keyhole openings, small openings either behind the ear or through the eyebrow. We can try to sneak in underneath the brain, still have the ability to do a large operation, but through a smaller opening. And easier on our patients, quicker recovery, a quicker return to work, and in many ways feel like it represents, the future direction of neurosurgery. They can be more difficult. There's certainly a learning curve, so I think the specialized training and the experience is really critical. They do require some specialized instruments as well. The operations are not necessarily quicker, although sometimes they can be. They are certainly less disruptive, and so less pain and less risk in general. And what's interesting is once you overcome the learning curve, some of the outcomes are actually quite better. Even our ability to remove a tumor, for example, might be improved with some of these procedures because the visualization is so nice. We use these high-definition cameras that we can pass in there, so we're working very close to the area of interest. So we get a beautiful view, and with the right instruments can achieve the same complete removal, sometimes in a much safer way. I don't think it ever gets old. I think I think it's like anything in life. If you choose something that you really are interested in and passionate about, that part never goes away. So every patient that I have the privilege of participating in their care, it's a joy for me, and it's always exciting. You're always worried in a healthy way that you're not going to do something that's going to be harmful, and you're always excited that you're bringing hopefully something new and innovative to their treatment, so their treatment today is better than it would have been before. But you always have to be very humble, I think, because it's a dangerous, proposition anytime you're having an operation on your head or brain. But it certainly never becomes routine. Yeah, we talk a lot about that, and it's important to keep in mind that the more traditional, if you will, approaches are still very important, and I do a lot of those as well. So we try to educate our patients, and obviously they haven't gone to medical school, they don't have the background that we do, so it's always a lot to learn in a short period of time. But we do try to explain to them the way things used to be done, the way some of us are doing it now, the pros and cons, and always give them a choice, obviously, of how they want to do it. And also, I think with experience, the more cases you do through a minimally invasive or innovative way, I think you become more appreciative of the role of the more traditional approach. And there are many, many times where that's much safer, and trying to do something that seems more cutting edge or innovative actually can be more risky. And that's sometimes a difficult conversation too. Some of our patients are very, very smart, and they do a lot of research. So they come in and they have an idea of what they would like, and they would like the newest or most innovative way. And sometimes it's actually the opposite conversation, trying to explain to them that the traditional approach is actually the safest approach for you. There can be. I think it's important to have experience, to have the right equipment, and to have a good team. We take that really seriously. Going into this without having the right folks around to help you, both with your surgical instruments, but also with the type of specialty backup you need. For example, a lot of the surgeries that I do are done with my ENT surgeon partners, so they're involved in a significant portion of the case. And doesn't matter, how good each one of us is. We both have to be, adequately good at what we do to take care of our patient. And then these operations are very technically intense. There's a lot of specialized instruments that are being used. So having the technicians, the nurses in the OR, the scrub technicians in the OR, everyone familiar and comfortable is really important. Otherwise, things can become dangerous. But like most high volume centers, if you do it a lot, your team gets used to it. It becomes their routine, and when their routine is something that's innovative, then it's no longer as risky.